Hello everyone. So today we'll be starting a routine case of bilateral varicocele embolization with routine difficulties. This is a case which has bilateral varicocele without too much difficulty. We all know why varicocele should be embolized and how it is done through groin without an incision. And team is here. We're going to start the procedure. So I am already into left testicular vein through the left renal vein, the routine one. See, we came up from there. My sheath, Mullen sheath is already into the left testicular vein. There is one branch going towards the capsular area. So this is the representation, and we are already into it and into the testicular vein to demonstrate another injection from the external inguinal region, and we are demonstrating these dilated veins. There are two veins, and there is the gubernacular region. There, some flow goes there, and one towards lumbar area, and then there can be some towards internal iliac. This is one which is refluxing, and I am going to instill the sclerosant. There is 2:1:1 ratio mixture which I am making. It's a nice way. Put up a 3-way, 2 syringes attached, and then you can quickly mix it into a mixture. But when you take it, you have to pull and take. If you don't do it, it's going to spill out. So now we're going to instill this into the left testicular veins, not in the testis, it's in the testicular vein. So we fill it, and after that we instill glue to create the effect of BRTO. So you see this, I'm starting with glue. That's the glue into these veins in the inguinal ring region, internal region, and then I'll go upwards. So you see a little more. That's a microcatheter now, and I'm withdrawing the diagnostic catheter. So this is a triaxial system. We use a sheath, a diagnostic catheter, through that. Yeah, there you see. Through that a microcatheter when we instill the glue. So that we're going up now. See that the column moving up. That's a column of glue. So the proximal veins, if they are occluded well, I've almost reached my sheath. Now sheath I'm withdrawing. Something sticking there. So what I'll do is I'll just use the wire to remove. And now I'll take a run for the right side. So this is the right side, you see, the right side testis. So now we'll get a microcatheter in place. This is a routine case, so I'm not demonstrating everything. We're just demonstrating right and left veins, how they're quickly embolized. The microcatheter, it's reached the inguinal ring. Yeah, there I have started using the glue. But before that, we'll instill some sclerosant. So the sclerosant is getting ready. Sclerosant with lipidol and some contrast. Make it 2:1:1, and then we have to instill it with the micro catheter, because in the right side we do not have a sheath in place. So Gaurav has started instilling the sclerosant. We still need to, so you can see how a 2 cc syringe can create pressure. 3cc syringe is usually what we train our hands at. So that's a sclerosin. We haven't started the glue. Sclerosin part Dr. Gaurav is trying to instill. So, the whole body anatomy, the abdomen is full of all the organs there. So, in that there is a small vein which we are dealing with. So, the whole organs in the abdomen can be shown in a graphic manner there. So, we are instilling glue now, that's my 3cc syringe. This is how I hold it. So slowly so I like to give it in the pulse manner. That's the glue column. Now there was some mistake, that iliac that crest is giving appearance of a glue column, but that isn't. This is what this exactly is the glue column which I'm making slowly. Yeah, that's the way. You see, look at my hand now, how I give it. I wait, withdraw microcatheter, and then it's a pulsed manner if there's no pain at all, pain is not involved at all. So that's a SIM catheter. You see how we have catheterized it, but this was almost L3 level ostia. Normally it's like renal vein, L1, L2 kind, but this is a ostia, and ostia is little lower down L3. But we routinely get it at this level, so that's not a challenge. So it's still a routine case, and that's the glue column we have got. So we'll try to get it a little more high, try to fill in some more branches. That's a second vein ostia there, that the 3 in fact, yeah. So we are going to upload it to get a good result, and then slowly withdraw our SIM upwards. We're drawing it upwards. That's a ureteric contrast going. It causes confusion. So ureteric urine is coming down, so that is creating some confusion. But then with an expert, the two varicoceles embolized, right? That's tough there, right and left. So too much vernacular veins there, they're washed off. Oscoran got washed off, but thumbs up दोनों. चल कित्थों आए हैं तू, कहाँ से आए हैं आप, थोड़ा अपना ब्रीफ इंट्रोडक्शन दीजिए. रोहतक से बस इतनी बात से हमें लगा था कहीं और से आए हो, यूपी से या बिहार से. नहीं तो हरियाणा 250 किलोमीटर से आए हो. 250 तो मिनिमम है हमारे पास आने के लिए. तो कितनी दर्द की मैंने? नहीं को ज़्यादा हो गया बस. I'm just taking it out. So there, yeah. So it's done. And there it is. The SIM has come out. And एक बार दिखाना दोनों